The doctor is in. I'm not sure where the doctor is tonight. Hopefully she'll be here any minute, but the doctor is in. And I'm so happy today to talk about how we are empowering young blessties and young women with breast cancer. And, I'm going to show a quick video. Haley made a video. Haley was going to be on the show tonight, but she's actually on a plane. So Haley and Emily kind of took this on as a labor of love and saying, you know what, we do a really good job with Love of My Girls for young women who aren't sick. And we talk to all blessties women who are sick. We give a really good job talking to Black women with TNBC, but we could do a better job providing resources and information to young women with breast cancer who are survivors, thrivers, warriors, all the things. And so they went to their little drawing board as usual, and Emily always writes everything that we do, our little Emily. And Haley and Emily put together this website that basically is on the Touch page, touchbbca.org. But we are basically trying to put together all the things that impact young women that are really different from someone like me who had got breast cancer in my 50s, right?
Mhm.
So I have these two beautiful, beautiful blessties here with me today. So you know what, you guys, I'm going to let you guys ask you to introduce yourselves, and then we'll show this quick video of Haley kind of, because she had FOMO 3 hours ago and made a video for us. So,
Awesome.
so LaToya.
Let Ebony go first.
Okay, let me go. Go ahead.
Yeah,
Let me
Ebony,
go first.
they first with me before.
Ebony's a novice, so you go first to help her out.
Okay. Well, hello, everyone. Good evening. My name is LaToya Bowles Johnson. I am a stage 3C triple negative breast cancer survivor. It'll be, I'm coming up on my 4 year. I always forget. Do we count from the day we were diagnosed, or do we count from the day?
From the day you are diagnosed, because at that point, the day you are diagnosed, you become a survivor.
Exactly.
Instantly. As soon as you're diagnosed, you become a survivor.
Exactly.
Right?
So Haley's birthday is actually my 4 year cancerversary, July 26th. It'll be 4 years since I was diagnosed. And it's been 2 years since I've been in remission, or the tumor has been out of my body. So I have 3 little girls, ages 5, 8, and 10. I was diagnosed when I was 36 years old, with no known family medical history. I was diagnosed when my baby girl was a year old, while I just finished nursing her. Found the lump on self-exam, misdiagnosed, not given the appropriate treatment, including not giving immunotherapy. Had to fight, and found myself into the advocacy role, and found myself in the Blessty community as well. Happy to be here.
So glad to have you. Yes, you are. And I'm so glad you're our advocate friend,
Yeah,
And
absolutely.
And so also, you know what? I changed the word cancerversary to lifeversary.
Lifeversary, that's right.
Right. So use lifeversary that you're celebrating. So
That's right.
Right. Ebony, I don't know you. I'm so happy to meet you.
Nice to meet you as well, both of you. Thank you for having me. I'm a newbie here, but I'm enjoying my time with you guys. So my name is Ebony O'Neill. I'm a mom of one, a 14-year-old. I was diagnosed with ductal carcinoma in situ and HER2 positive. Originally, it was stage 3. Just in the breast under the breast area. I was on treatment for like a year and a half, and then they seen like some mets in the brain. And that for me caught me off guard, because as soon as everything started to like slow down and kind of coast, this popped up. And that was in October. I originally got diagnosed in September 28th of 2022. And then with the Mets, it came in October of last year.
So wow, you were 2 years before it became metastatic.
Yes.
Ever given a like NED, like said, okay, no evidence of disease after treatment?
In the breast area, yes, but they never checked the brain. So that's kind of what I was kind of upset about, because I'm like, why don't you guys, if this is something that you see occurring in patients, you know, in the brain, why, if they're diagnosed, you don't just do a full scan of it? And they said basically it wasn't policy
Yeah.
in so many words. So I'm like, well, this is something that we need to fight for. Like, you know, I'm an advocate for a lot of things. This is unfortunately not my first cancer. I had childhood cancer, a rare childhood cancer that I beat, and it was a monster. And this is like my second cancer into adulthood. So basically, I received Gamma Knife. It was gone. Well, it did what it's supposed to do. It receded, but then this past, I would say March, they seen another one, but it was very, very tiny. And I just recently got that one, you know, blasted and with Gamma Knife, just probably like 2, 3 weeks ago. So now, you know, everything is good right now, but you know, it's up and down battle. You know, so
So when you had, did you have scans? Like, did you have a PET scan? So the thing about a PET scan, it doesn't look at your brain, right? It looks at the rest of your body. Because I remember when I had one, I had to have a brain scan and a PET scan. Did they not scan you?
so not for my breast cancer, for my other cancer, yes. But not for the breast cancer. I was only getting the mammogram, I got ultrasounds and CTs. So
So the,
When you were on chemo, you didn't get scanned.
not a PET scan. It wasn't a PET scan. It was those scans that I just mentioned.
usually the PET scan is from head to toe. Now, like the other scans, like CTs and MRIs, when those are ordered, those are usually like of specific locations. But the PET scan is the one that's nuclear, it's supposed to go everywhere. And that's the one that they use to like to even stage you, you know, like
Yeah,
when you're.
well, the
Yeah.
PET scans I didn't get for this cancer.
Mm,
I got a PET scan for my past cancer to check if that was in remission, or like, you know, to make sure I was
right.
stable with that. I'm not sure because the dates are fuzzy, but the PET scan didn't show anything with any cancer as far as breast cancer. I know that for sure. The only time I found out about the breast cancer, the first initial diagnosis, is me feeling like a little bump. And then after that, I was about to graduate school. So they asked me, it wasn't bothering me. I just thought it was like scar tissue. And then they was like, oh, did you they even asked me because it wasn't bothering me too much. They said, do you want to look into it now or do you want to wait till after graduation? I opted to wait. Thank God I did. But that's when I got a biopsy done, and you know, my plastic surgeon, it was my plastic surgeon because I have a lot of different comorbidities. So he looked into it and he was like, I don't want to just cut it out. I want to test it. So then when we did a scan, and then when we did the scan, he was like, let's do a biopsy. And when we came back, it was like metastatic. Well, not metastatic, it was breast cancer at first.
But it was breast cancer in your breast. So,
Yes.
but it was contained in your breast.
It was contained there.
And then what did you do? Like, what was your treatment?
We got chemotherapy. I was on it for every 3 week cycle. I can't remember the name off the top of my head. It's because it changed so many times in between then and now with different, you know, modalities and everything. So treatment, and then eventually radiation. So this area is stable. The chest area is stable. It's just the brain now that we're going back and forth.
So did you had surgery though? You had your breast.
Yes, I did. I had not both of them. It was only in one, the right.
So you had one breast removed. And
Yes.
you did chemo. And then, so did they ever tell you, okay, you have no evidence of disease before you were metastatic with the
Yes, they did.
You did.
Mm-hmm.
And so is there any place else in your body that you know
As of right now, no, except for the brain. That was it.
of? Okay. Right.
Yeah.
Yeah.
And I'm praying it doesn't go anywhere else.
Yeah.
That's
Yeah.
it.
Yes.
Yeah. All right. So, hey Mo.
Hey, Dr. Mo.
Hey, the doctor is in, and let me tell you, I have seen at least 3 young women today, 2 in their 20s, 1 in their 30s, and then a couple in their 40s, right? Like this is
Dang.
not a one-off. This is a sound the alarm moment right here. This is
It
something
is, it
that,
really is,
you know,
it really is. So,
Yeah.
so Haley had FOMO for not being here. She's on a plane right now. She made a video for us. So it's like 4 minutes or so. So I'm gonna play her video,
Mhm.
Okay.
and then we can, so she's gonna talk about kind of the history of how we got to this website that we launched last week. Because it was a labor of love of her and Emmy, you know. Everybody see that okay? Okay, I think I can hear it.
That's it.
Yeah.
Hi, everyone. Hi, Dr. Mo, and hi, Mom, and hi, Latoya and Ebony. Thank you guys for being on the show today. I'm sorry that I could not make it, but we're here to really talk about our Young Blessties page, which I think is amazing. We had this Young Women's tab for a while, and it just wasn't serving young Black Blessties. It was serving the Love of My Girls community. So we really wanted to make that its own microsite and put this here for Young Black Blessties. So, like any other Touch project, we start with listening sessions and focus groups to make sure we're actually talking to the community that's in that is a part of this. And so thank you for all of the women that were a part of this. There were so many that came to many different focus groups and listening sessions to truly see this. And thank you to literally everyone who sponsored this program because it is an amazing thing. And so first, again, here's a website. It's on the touchbbca.org website. If you go to the Young Women's tab, you'll see this. We hope that you see real women here. You see that we have videos to hear our stories. The women that were a part of making this were very adamant about not just saying their diagnosis and their name, but also like who they are. And so we wanted to make sure to share their real stories here. We also have some really, very clear facts about why we talk to young blesties and why it's so important to make young Black women aware of breast cancer. Obviously, the most striking is that Black women over 35 get breast cancer at 2 times the rate and die at 3 times the rate. This is well before you are told to go get a mammogram at 40. And so we have to have these tools and these resources for young women. And we have to honor the fact that if young women are getting if people are getting it younger, then we have to have resources for them as well. It was actually really interesting to think about, to hear from the young Black survivors, and hear that it was like we sometimes found things that were for young women, and we sometimes found things that were for Black women, but it was hard to find things for both, and that's who they are, right? And so we wanted to create a website that honors that. And so our resources are plentiful. We talk about the things that I think are really unique to being young, Black, and with breast cancer. So we talk about fertility and pregnancy in a way that I think is a little bit different, because you could be, maybe you're dealing with early menopause because of your treatment, or maybe you are trying to get pregnant. Maybe you are pregnant. Maybe you have to talk to your kids, hence the family and motherhood piece, right? How do you talk to your family? How do you talk to someone that you just married about this because you're young, or a potential someone that you're dating, right, about this, and just those unique differences about being young, and then yeah, how to talk to your kids about this. Again, that early menopause piece is also really important, and how to like, maintain your sexual self, and be that. And then we have romantic relationships and intimacy. That looks different. Again, how to like talk about this with people that you are romantically interested in. And then you have this education piece and career. Are you in school? How do you tell your teachers? How do you tell your boss about this, right? All of these things are here. And then body image was a really big piece of this as well, and how to maintain that. These are really, depending on when you get it, you could be going through a really impressionable time. And so we wanted to honor that. We also talk about beauty and your needs there, hair, makeup, all the things. It was really, really big to bring integrative and holistic care into the conversation, because the young Black woman is really in tune with their spiritual self. So we wanted to honor that. And then we also talk about self-advocacy, shared decision making. That's super important. And then obviously how to talk to your community and be in community and find community. So many resources here. These are some of the amazing women that have helped with this. You have Latoya here with 2 of her beautiful daughters, and Deltra, just some amazing women who have always been a part of the Touch journey. We wanted to honor them. We have some FAQs here about about talking to your doctor, managing side effects, financial support. That's a really big thing. And then also, of course, what we talk about at Touch all the time, which is our clinical trials. And so Again, please check this out. We have some easy like plug and play posts if you wanted to use any of these to share more about our this website and this and these resources. We're still uploading all of our partners that were a part of this, so stay tuned for that. And yeah, that is the new website. It was really important to honor all the things that women said, so we used the colors of jewels, like that was recommended, and we wanted some neutrals in there and really wanted to make sure that it matched young Black women. So thank you guys, and I hope that it's an amazing show tonight.
Wow, that was pretty awesome. I have to say, like that, it covers so many of the issues that that our young blesties deal with. And I'd like to get into some of those issues because some people watching might say, breast cancer is breast cancer and it affects everybody the same, but there are some unique differences. And I know Latoya and Ebby, maybe you all can talk about some of the ways that breast cancer impacts you as a younger woman differently.
And and you guys may not even know because it's your normal. You don't really know what's different about it, right? Because it's your normal. I mean, it's kind of what your experience is. You know what I mean? So I think like,
Yeah, and what resources aren't there? What did you look for
right,
and
what are
you
you
couldn't
missing?
find?
Yeah,
Yep,
yeah,
what's
yeah,
missing?
yeah.
Yeah, I know for me, like initially, Google didn't show a lot of images of my skin, like people with my skin tone experiencing, going through mastectomies and reconstructions or whatnot. So I think that's very important to also show people of different hues, of how it may look on, in my skin tone with, reconstructions and things of that nature. Like it was, that part of it. And yeah, you're right, like I didn't know firsthand like what other people are experiencing, but I going through like different uh support groups, I do know that my experience was different because at the time my children was toddlers. They were 4, 6 and 1. I had babies. So you know, it was way different from me because I didn't have, I had to make sure, thank God my husband was here because he held down the fort a lot. But I mean, I still had to make sure their well being was okay. There was just so many other different factors that went into, still concerned about them, but still trying to heal myself and go through chemo. But it was still like I still had to navigate children and being a wife and being supportive of him as well as being a caregiver. And it was just a lot because he needed support as well. But it was just a lot. I mean, it wasn't a blueprint, it was just kind of like you're just going through it. You're just going through the emotions. It's kind of like
Yeah.
you're just walking through the blind and just trying to figure it out, as you go along. I wish that, this support group, this Blessty page and all these different resources was available, about 4 years ago when I was diagnosed. I mean, that would help a lot. Definitely.
Yeah, because when I was sick, I didn't think about fertility.
Yeah.
And I mean, I didn't think about, even having to deal with babies in the house.
Yeah.
You know,
Yeah.
Haley was
Yeah.
19. She took care of me. I couldn't imagine, having
Mm-hmm.
to take care of people.
Mhm. Yeah, it was a lot. I mean, it was very like one thing I always tell people, like even people that I hear about now, like if they get diagnosed and I know they have children or whatever, the first thing I want to do is like send them DoorDash because I'm like, the meal part was the most helpful thing for me and my family because we had children. So if
Okay.
my husband didn't have to worry about their dinner when I got home from chemo, because now I'm laying in the bed and now he's tending to me, like dinner was just, I can't explain to you how big that is. So my neighbors like bringing me dinner or things like that. That was like so helpful if you could just especially if they have children, like meals is such a big contribution that it may seem small, but it's not. It's
Yeah.
really helpful. Yeah.
And
We
your
need a
husband is
baby.
a jewel. I mean, I've been there with him, like doing all the things. So
Right.
he couldn't make dinner, it was serious, right?
Right. Right.
Wow. Wow. Wow.
Yeah.
Ebony, what are
But
you thinking?
For me, it was a lot of different things when I first got diagnosed. It was a lot of different emotions. One, because it was a new stage for me. Like I said, this wasn't my first cancer. First breast cancer, but this wasn't my first cancer. And it seemed like for me, it was like every stage, different milestone of my life, I got cancer and re-diagnosed again. It was in my teenage years. Then it was in my older teenage years. Then it was my young adult. Now I'm in my older adult and I got breast cancer. So it was like a different time period. And I had to worry about a different aspect of life at that time that I didn't have to do, in between. So now getting diagnosed with breast cancer, I have a child now. Like I had a child back then, but now she's older. She's in school. She's in junior high school. So then that plays a factor as well. This one was different because till this day, a lot of my family don't even know that I had breast cancer. And I was
Really?
yes. And that was personal for me because I said, you know what? Everyone was so involved before. I have a big family to support, like my mother, my dad, my siblings, my immediate siblings. But everybody, I just was like, I want this battle between me and God. Like, I want to get through it, me, myself, my focus, and I don't want it to be a show. Meaning like, for me, I don't like pity parties, because I had it so much growing up and the attention. And for me, it's just like, all right, let's just get through this. But the only difference between now is like this one compared to my other ones, the longevity is longer. Like it's not just cut and dry. Before it was like I'll be diagnosed, I'll get the treatment, and then it's gone. A few years later, come back.
What kind of cancers did you have before?
I had chondrosarcoma. It was a rare tissue cancer.
No.
Rare tissue cancer. So and that one was like my monster. It was bad.
Wow.
Do you have
Yeah.
any genetic mutations?
Yeah, I was gonna
No,
ask
when I
that.
did the what is it called? The genetic testing
Testing, yeah.
came back nothing inconclusive. I don't know the wording.
Unknown variants, whatever the
Yes,
hell that
yes.
means. Right,
And
right.
that was kind
Yeah.
of they was kind of shocked because it was just like, you had two different ones and it came back that. So I'm like, but also with the now, you don't think about, for me, I didn't want to have any more children, but now with this, you're like, can I have more? If I wanted to,
Right.
what's the possibility of that? Like, so you think about those things like that.
How old
My
are you?
23-year-old asked me today, she said, when is my period going to come back? Right? And she's
Yeah.
like, what's up with my body? I used to be skinny. Now I got a pooch. I got a belly. Like, what do I need to do to get back to normal, to get back to things? And it's something that, we don't always talk about in those terms because
Yeah.
everything is different
Right.
now.
Right.
Right? But
Mhm.
getting back to the you that you felt like you were before
Yes.
is
It's a
really
struggle.
Yeah.
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 can be. It can. So I want to ask you though, Abby, about that. You talked about not telling your family. Did
Mhm.
you told your child,
Yeah, my daughter knows. Yes, for
your
sure.
daughter?
Mhm.
Okay. And then
Yes.
what do you all, I know Toya, you talk to your girls too.
Yes. Yeah, I
And did
mean,
you talk to them early, immediately, or did you wait a little while?
they were so young, Dr. Mo.
Yeah.
They were babies. They didn't know what
They
that
didn't
was. I mean,
understand.
they didn't have a better understanding of it now. They're 5, 8, and 10 now, but I mean, they really didn't know. Now I can tell you this, my two older ones, they know what a breast exam is. They know how to do their own breast exam and they don't even have
Right.
boobies yet. But I was adamant about, okay, you're
Mhm.
gonna know how to do it because truthfully speaking, when you get hit with cancer, you just look at every day. It's like, okay, I don't know
I
when
mean,
God
yeah.
is gonna call
Yes.
me home. So let
Mhm.
me try to do whatever I can do now so that, when I am gone, it's like, okay, they know these things. And, so I mean, I'm hoping that that they grow and I'm able to see them grow, as
Yes.
become women and things, but you just don't know.
Yeah.
Um, and one of the things, Dr. Modi, you mentioned about like menopause, you said one of your patients asked you about her period.
Mm-hmm.
For a woman who is premenopausal or whatnot, going through this cancer, and it's like we call it chemopause, right? Like when you go through it, your periods are stopped because your ovaries are suppressed because of chemo, and then once you're off it, it's like no one can really predict when it's going to come back,
Mm.
and then it comes back. I know for me, mine did return, but they are completely irregular now, and so now my OB, and that's another thing. If you are irregular and you are still at that childbearing age and your periods do come back, make sure that you are staying in connection with your gynecologist because if you're not regularly menstruating, and there's other things to play into that, right? Especially when you've had chemo, because now you got to think about bone health. Now you have to think about, okay, my gynecologist told me, okay, if you're not getting a period in 3 months, you need to let me know, because there's different things that builds up. I need to check your bone health. We need to do other things. We might need to do those DEXA scans. There's different things that comes into play, because of the hormonal imbalances that you may have. Because chemo, I mean, going through chemo and cancer, you just don't know if your periods are
Mhm.
going to return to that normal baseline, and mine have not. So,
Right.
Yeah.
it's just other
Yeah.
things that don't stop. Like, you may be done with chemo, but there's so many other post or residual effects that you're still dealing with as a woman. So always make sure you stay on top of your visits, especially with your gynecologist and your primary care.
Mhm.
Yeah.
That's
How old
great
was your
advice.
daughter when you first got diagnosed with breast cancer, Ebony?
She was 11.
11.
Yes. And
Mhm.
she fully understands because she knew my cancer from the past, but she never was like she didn't have to look into it as much as she did when she was 11 because now she understand it more. Um, and it was like it was rough. It was more so we couldn't do the things that she wanted to do sometimes, like go out because my energy was low, or that's when I was really on chemo. So I was like weak like I'm building myself back up to get like back
Yeah.
down,
Yeah.
So it was a lot of different emotions. But now she's 14 now. So she's more acclimated with it. She helps me out a lot. She's now, I prepared her from young before she's 14, but to like Latoya said, just in case I'm not here one day, you
Yeah.
know.
Yeah.
She's working summer youth now, she graduated and everything. She has her own bank account. She's doing money, management, finances and everything. So I'm getting that stuff out the way.
Yeah.
I know in the name of Jesus I'm gonna be here, but I want to make sure my baby's prepared in case of anything. You know what I'm saying? So
Right.
now she's fully versed in it, and we take it one day at a time.
That's
That's
all
what
you
we
can
can do.
do. That's all you can do. So,
Mhm.
so right now you're on chemo now, right?
Right now I'm on oral chemo, and
Oral
then I
chemo.
have
Okay, so
the
that's better than
yes,
infusion.
yes.
Mhm.
I've been on that for a while, but it's and then I get the injection. What is it? So many chemo brain is so much because it changes, but I get the injection, and then that's it. But yeah, because I was on capecitabine, but that was too
Mhm.
much on my body. That actually made me lose a significant amount of weight, and it was making me very fatigued, and we had to stop that. So
Mm.
yeah,
I
it
took
was a lot.
considerably. Yeah, I
Yeah.
took that, and it affects everybody
Too,
differently
Toya?
too.
Hmm?
Yeah, I was saying I took it. I took capecitabine, but it didn't. I didn't really get that sick. It's just, everybody gets
Yeah.
different side effects from the meds.
Yeah.
Some people
Mhm.
it affects them worse or not. But um, I wanted to ask Dr. Mo. I mean, Ebony, when you were talking earlier, right before Dr. Mo joined, you were saying like your doctors were telling you, oh, it wasn't policy, or it's not, standard of care or whatnot, when we were
That's the
talking
word.
about the
Yes.
scans or whatnot. And I know we've kind of touched on that before, that, what the standard of care. Dr. Mo, touch on that. What is a standard of care for someone, once your doctor says, okay, you're NED, and then they say,
Mhm.
okay, just come back in 6 months and we're just going to do blood work or physical exam
Mhm.
6 months. What is the standard of care, Dr. Mo?
So, in general, standard of care refers to the evidence-based guidelines for what we should do for something, right? Based on all the old studies and emerging data and the consensus from different doctors who make up the guidelines, right?
Mhm.
For young people, many times there aren't a lot of rules and standards because you weren't supposed to get cancer in the first place.
Right.
Not that anybody's supposed to
Right.
get cancer, right? But the guidelines and the rules and the standards weren't developed with you in mind necessarily.
Mhm.
Right.
And so one of the questions you got to ask your doctor is, okay, I understand that this is what the guideline says for people with my type of cancer, but what about people with my type and my age,
Right.
right? Because what does that mean for me? So for example, with the scans, when people have early stage breast cancer, stage 1 or 2, after their treatment is done, we don't necessarily do things like PET scans and MRIs and
Right.
things unless you needed that beforehand. Like if we saw a cancer that you couldn't see on mammogram or ultrasound, which y'all are too young for mammograms, most of you, right? So we got an MRI, you found something, and then we do surveillance with that moving forward. But that doesn't include stuff like PET scans, to your point. And when you're metastatic, there's a different path, right? You try different drugs to make sure that the disease doesn't pop up again. And some doctors will wait until there are symptoms, right?
Yeah.
Well, if you
Yeah.
start having back pain, then let me know.
Yeah.
And by then,
It's already
it
there.
might be further along than you want it to be.
Yeah.
So it's
Yep.
it's a really tough conversation to have with your doctor, but it's one that says something like, okay, I understand that, insurance doesn't always cover these scans without symptoms, but why should we have to wait until I have symptoms that would mean my
Right.
cancer
That was
spread?
my
Exactly.
question, exactly the way you said it. And it was kind of like I kind of got pushback from it because it was like,
Yes,
it
is
was
not in
like,
guidelines.
yeah. And I'm just like, well, if this is happening often and frequently, and I asked that question,
Right.
and then the answer
Right.
was yes. I said, so why don't we make that? She said, well,
Right.
there's research happening now regarding that because it's an issue.
Yep, there
So
is. But the bottom line is that, I tell patients this, and this is Dr. Mo talking. I shouldn't say on behalf of any hospital or institution, not on behalf of blackdoctor.org. I have to dial all the disclaimers, not on behalf of Touch the Black Breast Cancer Alliance, etc. It costs me nothing to
Yeah.
order you a scan other than the
Right.
time it'll take to defend and
There
to
we
have
go.
the peer-to-peer.
Right.
And when I have 4, 5, 6 peer-to-peers to do, meaning we have to talk to the insurance company and get them to do
Yeah.
something, right? But that's part of what we're supposed to do. And
Mhm.
so, if you are having neck pain, back pain, wink, wink, whatever's going on with you,
Right.
then it's my job to order and do the workup that we need to do to see what's going on. And
Exactly.
so, that too is a way to talk to your doctor about these things. What do I need to have? Okay, right. Okay.
Right. Yeah, my
Um,
doctor, even, after 5 years, my doctor wanted to, okay, Ricky, you're done. I'm like, no, 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 no. He said, come back when
Yeah.
you're symptomatic. I'm like, no. And so
No.
we went on
Yeah.
for till year
Mhm.
8, till I was year 8, basically, and he lied to get me a scan.
Mhm.
yeah.
He
Because
made
I
me,
mean,
he reported a symptom to get me a scan.
Yeah.
right. Yeah, that's what you have to do.
Yeah.
And Ebony, to hear you say you were on capecitabine and you lost weight, guess what? You have weight loss.
Yeah.
How do we
Yeah.
know it's from capecitabine?
Right,
How do we
right.
know? We're
Right.
assuming,
Yeah.
Right. Right.
but do we know?
Right.
Right. So there's ways
There's ways
around
around
that,
it. There's ways
but it
around it.
doesn't make
No,
Right,
it's
it,
never
right.
the
doesn't make
answer.
it
It's
right.
always how. Yeah.
That advocating for yourself has to be disingenuous,
Right.
but that has to do with insurance companies. And it has a lot to do with the fact that all of the old data says that young people don't have this. They don't get metastases. They don't blah, 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 blah. But the face of cancer, the landscape is changing.
Mhm.
And even the guidelines conversations we're having at NCCN and other places are really trying to, some people are just sitting there resting on their laurels, like, nope, this is the dogma. You got to be a certain age and it's got to look a certain way. And the rest of us are like, ding, 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 something's happening here.
Yep.
Young people are
Yes.
getting this more and more, and it
Yeah.
doesn't fit the classic mold. We got to stop
Yeah.
sending them
Yeah.
away. We
Yeah.
got to stop saying not to screen. We got to stop, not addressing all of these things because it's based on data from older people.
Correct.
Yeah.
Yeah.
So
And
ask
and
about
no,
the studies for
And
young
I
people.
think the insurance companies have not caught up with
Not
the
even
rest
close.
of the world, right? You know what I mean?
Yep.
I'm finding
Mhm.
ways not to spend money. Hello,
Yep.
right?
Yep.
Um,
Yep. Not even close.
they're
yeah.
not even
But it
following
does.
the guidelines
Go
that are
ahead.
already. They're not even following. I mean, we know some. I don't want to get flagged, but we already know some of the insurance companies are not even following the established guidelines
Mhm.
No,
for
they're not.
reconstruction. And you have
Right.
surgeons that are having peer to
Right.
peers and fighting with these insurance
Right.
companies
Mhm.
for
My good buddy, Dr. Potter, right? Come on with it, right?
Dr.
Struggling
Porter.
right now fighting with a certain insurance company,
I
but
know, look at
it's
that.
true. But you
Yeah.
know what? The thing to think about and to do also is when you see studies and you hear studies that are inclusive of or unique to young women, participate in them.
Yeah.
And you see sometimes people say, well, what, I don't have time for that. I already have my family obligations. I got my kids. I got everything going on. But it really is how we learn
How
more
we learn.
about the side effects, whether it's fertility, whether it's sexual side effects, whether it's, dosing, whatever the things are
Yes.
that we need to learn to make medicine more precise for younger individuals, especially young Black women. we need to do, because otherwise they will always give you the most toxic stuff because you're young. And they say, oh, well,
Yes.
you're young, you can take it.
You can
And you
take
get
it,
everything
yeah.
that's toxic.
Yeah,
Yeah,
exactly.
but again,
Yep.
we need more science. I signed up for a clinical trial yesterday at Georgetown, so I'm gonna keep doing
Mhm.
it, you know what I mean? And I don't even know what it's for, but I qualify, but they,
Right.
you know, triage me, but we just don't
That's
know,
true.
and we don't think, I don't feel like the age thing has been addressed effectively in
No.
that fashion. So whether it's whatever the testing is, whatever the screening is, whatever the scanning is, no one's saying, okay, young is different. And now, now we're starting to see breast cancer in young white women.
Mhm.
Yes.
Hello. So
Mhm.
maybe the policies will accommodate age because
Yeah.
of them. I don't know,
We
but right
hope.
now
I
it's not
mean,
not
I'm seeing them get sent away from their doctors too.
Yeah,
Oh,
they
it's
are.
probably nothing.
Yeah, it's fine.
Oh, it's fibrocystic. And
Yeah.
my six words, how can we be more sure?
Right.
Right?
Yeah.
Right.
How
How
can
do
we
you
be more
know?
sure?
Yeah,
Yeah,
yeah. How do you know? So
it's true.
it's happening all across the board, but maybe it will get a little more attention. I just feel like we need to be doing more. We just don't have enough data. And even as we're recruiting for clinical trials now for some of our pharma partners, I'm
Mhm.
like, that comes to us, can you help us find Black women? I'm like, okay, but what age do you want? I mean,
Mhm.
we're going to try to find you all the ages, right? Because I don't want to limit it to the 70-year-olds, right? Because they
Mhm.
haven't really thought about that yet in terms of like making an age difference. But have you broken your trial down so you're looking at not only the Black women, but the Black women under 40, under 30? Like, what
Yeah.
does that look like in terms of really, really looking at the data in the right way and breaking it down where we need it to be?
It's true. The
Yeah.
problem though, Ricky, is that when you have such a small cohort of Black people, you can't
Yeah.
even stratify it by age,
Right.
right? If you got 2%,
Right.
even if you got 10%, let's say
Right.
your enrollment, your accrual is, 700 women,
Yeah.
right? And you get 70 of them. The ones that are probably under 40, you might get 3, you might
Yeah.
get 4,
Yeah.
right?
Yeah.
And so even if you have a 10% accrual rate, you still don't have enough to say anything definitive, which means that we need to be
More.
targeting it and thinking about it in the way that you're suggesting, right? You have to begin with the end in mind.
Right.
Because if you know, right, you want to do a subgroup analysis of young women, you got to recruit enough young women. Otherwise, you can't just say, well, let's look at the age. And you only recruited
Yeah.
2 of them to begin with,
Yeah.
right?
Yeah, because they're coming back to us and say, can you get like 5 Black women a site or whatever, you know what I mean, for these sites or whatever. I'm like, okay, well, how old do they need to be? And what does that look like? You know what I mean? And trying to at least
Mhm.
representation. But
Yeah.
I want to talk about the resources a little bit. So I'm gonna go back and share the page because I want you guys to look at this and tell me what we're missing. Have we covered what we need here? So here's our page and what are we missing? Well, I think I shared Haley's video. Whoops. Not the page. Hold on. Like what are the things that we should be adding to this or putting more attention on or just making available to people that we need? And of course I can't find it on my screen. There we go. Is this it? Yeah. So we're talking about fertility and Mo, this one cracked me up when I looked at this one because a lot of our content is, where is it from? It's from the Doctor Is In. Hello.
We
Because
covered a lot these 5 years. We
look
have
at this.
covered
Look at
a
this. Let's
lot.
talk about fertility. So here's an
Oh, that's an old flyer too. Look at
it's
that.
old, yeah, right?
Oh,
So
man.
I mean, when we did the whole, Facebook basically took down all the lives, right? So we had to go back and move everything new. And we look back and people were viewing episodes from our year 1. We're now
Yeah.
5 years old. And so we have this content. It's all here.
Yeah.
Right.
So we went to talk about it. We didn't have to look too far beyond our own library,
And go back to that though, Ricky, because the first thing that I see when we talk about fertility is even knowing to ask about it.
Yeah.
Because not every doctor will ask, what are
Right.
your fertility wishes? Where are you in your fertility and family planning process? Like
Right.
that question,
Right.
it's generally an
Sure.
afterthought after we go through your receptors and your treatment and the surgery and who's your nurse and what's going to happen. You may or may not get the conversation that says, okay, let's talk about fertility. And
Right.
if you do get the question, a lot of times it's fertility in this moment.
In
And
this
like,
moment,
okay,
right,
and
right.
don't get pregnant because it's a really bad time to get pregnant because
Yeah.
that changes your whole treatment plan. If you get pregnant
Yes.
with, chemo surgery, like you cannot. It messes up the surgical plan and it can be bad for mom and baby. But what about your future fertility
Right,
plans?
right. And
And what are your wishes? That conversation doesn't
That
happen with the
conversation is
surgeon,
not.
what's the
especially.
long-term impact? What is the long-term or what is your fertility plan? Did you have a plan to have kids?
Right.
Did you think about that before? And you know what? Many of us probably haven't, when you're
Right.
talking about a 23-year-old that you saw today, or right? Has she even thought about, gosh, when am I gonna have my
Her
first
main
child?
question about her breast, were they going to match?
Right,
And would she be
right,
able to breastfeed one day, someday, eventually?
Yeah.
right,
Yeah.
right,
And
right,
she asked me,
right,
are you pregnant? And she said, no. And I said, well, you plan on having children? She said, eventually. I hope they breastfeed after this surgery. And I said, I don't know. I hope so, but I don't know. And
yeah.
so the fertility and pregnancy part, the number one thing people need to know is that if your doctor doesn't ask you about it, you can ask your doctor about it and ask
Ask your
her.
doctor. Yeah,
Even if
yeah,
you're triple negative.
yeah,
Triple negative, guess what? You can go through IVF,
yeah,
right? You can get a
yeah,
couple rounds in, you can get
yeah,
some eggs observed, and you can do you know what I mean? There's some,
yeah,
it doesn't
yeah,
mean that just because you have cancer, you don't have the time to go through egg retrieval, right?
yeah. And
And
then,
that's a
but then
real
it boils
misconception.
down to this one. It boils down to how much does that cost? Do I have the money?
But then
Mm-hmm.
also my question is as well, like, all right, say you do get pregnant or you do in the future decide to have a child, what is the risk? And like, with the child coming out with, certain abnormalities or anything, like for me, like with the chemo and different type of, hormonal therapies and things like that, that in the back of my mind is a concern as well. That's not being talked
Yeah,
about.
yeah, yeah, yeah,
I understand.
Yeah, no, that's true.
yeah.
And then what happens if you are pregnant, right? Like
Right.
getting diagnosed while you're pregnant is a unique circumstance, but we
Yeah.
see it. And,
We're
we
seeing
need
it.
to help people understand, not just pregnancy after cancer, but what happens if you're already pregnant?
Yeah.
Can you go through chemotherapy? Is chemo safe during pregnancy? Can you have that baby and then start your treatment? Can you go through surgery and then do chemo after you deliver? Like, what are the options? And there are lots of options for cancer treatment during pregnancy. It's
Right,
just
Oh
if you
wow.
get pregnant during the cancer
right,
journey, that makes
right,
it a little bit
Yeah.
challenging because some
right,
of the
right.
drugs are
But we've
what we
got,
call teratogenic.
we've got those
Yeah.
resources too, like,
Yeah.
um,
Yeah.
so we try to cover that base as well,
Hmm.
and then you look down, why do I keep going back to Google here? Um,
Mhm.
um, but
I
yeah,
know,
we try
I
to
know a couple of
cover.
women who've got, who got diagnosed while they were pregnant, and that actually were dismissed. One of the blesties, my childhood blestie, she transitioned, but she
Yeah.
had to advocate for herself during pregnancy. Her mother had breast cancer, died, and her mother had breast cancer. She was having like pain in her breast, and because she was pregnant, her OB kept telling her, "Oh, that's just associated with you being pregnant." It's just because you're pregnant. And months went by, and it wasn't until like she was 8 months, and she kept complaining about the the
Mm,
the pain, right? And that's when he did some tests and imaging, and that was determined that it was breast cancer, and her pregnancy was induced, and so they could deliver the child, and so that she can start chemo right away. And it was a very hard time for her because she got diagnosed. Her mother died like right after she had the baby, and then she's dealing with breast cancer treatments are on her own and a new
mm,
baby. Like, it was a lot. And so
Okay.
that's another thing too, is like, even though you're pregnant, yeah, you're going to go through certain aches and things like that. But if something doesn't feel right, you have the right to push your physician and say, look, this is still bothering me. Like, how can we just rule it out? You can say those words. You can say, how can we rule this out, that it is not something that's cancerous, especially when you have someone who has like a first degree relative and they're saying, hey, my mom has breast cancer. I'm having pain. Let's
Yeah,
figure this out.
something's wrong. Yeah,
Yeah, like what are your different, things you can discuss with your doctor. Is all
yeah,
about their
yeah,
decision making that you have on the tab from the bottom. Like,
right,
what are the differential diagnoses for what my symptoms are? That
right,
means the doctor or the provider has to tell you all the things that they're thinking of that may be pointing to what your complaint is, and this is how they've ruled it out. So
right,
those are the things, those are part of your shared decision making conversations to have with your provider.
right,
Yeah, and know which provider to ask which questions to,
right,
because that also makes a difference.
Yeah.
Because asking, a radiation oncologist about fertility, you might not get a good answer there.
Right. Right.
Right? So knowing where to find these resources, and if they kind of don't give you a good answer, say, you know what, I know this might be out of your wheelhouse, but whose wheelhouse is it in?
who should I come to? Or
Right.
come to us and we'll help you.
Come
Come
to
to
us,
us,
absolutely.
come to us and we'll help you figure out where you need to go,
Yeah,
Mhm.
they can refer you. You don't want, it's like you have a Toyota, but you don't want to like go to the Mercedes dealership. You want to go bring it to the
Right.
Toyota dealership
Right,
because
Right.
that's what they fix all day long is a Toyota. So
right,
yeah.
Yeah. And it's a reason why doctors will sometimes be dismissive because they don't know the answers because they didn't learn it. We didn't learn this stuff in school,
right.
right?
They
Yeah.
don't
When
know
we were
this.
in school, we were taught cancer is a disease of aging. And so
Yeah.
it looks a certain way. And as the older
Right,
you get, and this is what happens, and the cells
right,
make mistakes, and da 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 da. And so these are not necessarily things that you learn. You learn them from going to conferences. You learn
right,
them
Yeah.
from doing your own research. You learn them from participating in trials and being an investigator. But if they don't know the answer, they will skirt the issue, and they'll be kind of like, well, we asking that one for, or you know what, just go check it out online, or talk to the navigator about it, and it may feel dismissive. And that's why I
Yeah.
said it's always safe to just say, okay, this might not be in your wheelhouse, right? You might not know about nutrition. Okay, I get that, but who can I ask about this? What resource
Right.
do you have? And that way they can refer you to somebody within the networks too, because sometimes there's resources in the network and financial coverage for things that you didn't know about. And
right.
that they might not have known
Right,
about,
yeah,
you
yeah.
know? So that navigation piece is super important.
Yeah, yeah, and we tried to sort of make this when we, because we kind of think of everything in terms of what would navigation look like. So we tried to
Mm-hmm.
make this website kind of a online navigator and have all the things here, but I mean, there's always things that sort of fall out of the realm of what you put on the page, but even stuff like body image
Yes.
and Latoya and I've had many conversations about
Yeah.
body image and how it makes you feel. And how long did you go with before you had your D flat?
Ooh, just even thinking about it makes me emotional. It was what, 2.5 years.
Wow.
And most of the surgeons said no until I met Dr. Potter. Like I just wish that, and I found out through like online support groups that I wasn't the only one in this box. Whereas they tell you, okay, we're gonna chop your breast off, and that's fine. That was my decision to do that. But it wasn't a well-informed decision, right? I didn't understand or didn't know that, hey, yes, we're gonna chop your, you're gonna have a flat closure bilateral mastectomy. That's what I had, right? But I was just, I didn't want the implants. I didn't want any of that because I was like, I want my own tissue to make my own breast. But no one had said to me, hey, listen, well, if you don't have the ideal BMI, we're going to put this stress on you that you have to have a certain BMI in order to qualify for this after the fact. And I just feel like that's very cruel for a woman who's gone through breast
Yeah,
cancer at my age, at 36 years old, to not tell me like,
yeah,
hey, that might not be the best choice for you because you may not qualify for this right now
Right.
because you're
Right.
not, a size 4, and I'm a curvy girl. I'm just keeping it real. And then add on that, I'm just had 3 babies back to back, and then add on all these steroids that I'm receiving through, chemo. I mean,
Right.
it's just not an ideal situation. So it's like you really, I had a lot of body dysmorphia issues, dealing with that being flat. I mean, in my 30s, like who wants that? You know,
Right.
I mean, thank God. I mean, it did make me feel a little bit better. Like I was able to get, boobs, like prosthetic boobs that match my skin color from Dr. Hampton, which is another thing because many women, I've met
Right.
women who like in their 60s and they've had like this white,
They got white
prosthetic,
big boobs, right? Oh my
yeah,
God.
and not want to match their skin tone, so
Yeah.
it's so many different things that people like we're all a team, right? It's all a collaborative approach, but and I know that surgeons can't think of doctors and surgeons, everybody can't think of it all because, like you said, Dr. Mo, like you're not taught all of these things in medical school, and they may not taught all these things in PA school. So that's why it's like a collaborative team approach that the providers really need to listen to the patients too, just so they can educate them about that, so that they can
Right.
make that well-informed decision. To
It's
say,
true.
okay, this is what it's going to look like post mastectomy. Because I
Mm-hmm.
can go to Google and pull up what I'm like, well, Latoya's body is going to look like in my skin
Right.
tone, with my
Right.
scarring, with hyperpigmented. I can't see what that's going to look like,
Right.
you know. So
Yeah,
that's so important.
Right.
you're right. And it's also why, the whole deal with deep flaps, especially using, your tissue, autologous tissue, one, you got to have a certain BMI in order to have enough to move, right? That's one thing. But
Right.
two, you got to have another certain BMI. You got to be right in this kind of this window to not be at elevated risk for failure and complications. Three,
Right.
you can't have had multiple abdominal surgeries because you need the blood supply.
Right.
And then, so there's all this sort of criteria for that. But I tell patients to really, do consider one, flat closure is an option. It is a first option. It's not the last resort. If something gets infected, it
Mhm.
has to be removed. But two, do
Right.
consider a tissue expander because it gives you
Mhm.
options. It saves that
Right.
skin, it preserves that space so that whatever you decide to put in there later, you will have the skin you need, you'll have the space created, and then you can, and you can always go flat later. If you're
Yeah.
undecided, don't decide. It's okay. Don't rush
Yeah.
into it, you know?
Yeah.
You guys
I
are
mean,
giving me another topic to add to our list here. And
yes,
it's
because it's
surgery, plastic
Reconstruction. Yeah,
yes,
surgery and reconstruction.
reconstruction.
Yeah.
yes,
Reconstruction,
yes, yes,
okay,
yes,
that's gotta go here,
yes,
and
that has to go
really
there.
all treatment, all treatment.
Hmm.
Yeah.
And also too, like, and I know I shared this with you, Dr. Mo, before, like I wasn't given out the expanders. It was just like, oh, you have to have 30 rounds of radiation. We don't want you to develop,
Hmm.
complications from the
Right.
expanders. But like it was just that. But no one considered the psychosocial, the psychological, the stress that put on me. Like, cause like you say, you could put the expanders in. Okay, if there's a problem, we can always take it out, right? But at least
Hmm.
like give me that option.
Choice, the
Don't
option, right,
take that
right,
away from me. Don't
yeah,
take that away from me.
Right.
So
yeah,
you should add that, Ricky, for sure.
I got it, yep, I got it, I think that, and I think we have some of that stuff, let's see what's under body image. But I think the whole, um, the whole concept of reconstruction, we need to probably address here.
Hmm.
Like what's under beauty.
Yeah, for sure. And also people need to know like there are if they are flat, that there are prosthetics out there that match their skin
Yeah,
tone and
yeah,
makes a
and
difference.
prosthetics and stuff, yeah. Um,
Yeah.
um, like what are your options to not be flat or not kind of, right?
Sure.
Hmm.
Or, right? Flat or dot, dot, dot. So I think, also I thought I had a new thought today. I read some article or something that got me saying, and we always talk about health is self-care. Health
Hmm.
is self-care. This is self-care. But then I said, you know what? It's self-love. It's bigger than care. Your health
Hmm.
is self-love. So it's you loving yourself and doing the right things for your body to love yourself, you know? I think
Mhm.
self-care ultimately is for self-love, right? But I think we should start talking about and use that concept more. Um, and here when self-advocacy, where you kind of what are the questions you want to ask your doctor? What are the
Oh,
things you
that's
want
good.
put on here. So what are the priorities, you know, and you know, our CEO of Your Own Health, something, we have our PDF here, you can
And bring somebody with you, somebody who can
Yeah.
ask
Somebody
good
with you.
questions
Yeah,
and who is going to be, you know, in
Yeah.
there with you and not just one
Yeah.
fall apart,
yeah,
or two not just on their phone, like somebody
Yeah.
who can be an active listener,
Right.
yeah,
you know,
Right.
and ask questions that you may not think of.
yeah.
Yeah.
Yeah, but
Yeah.
then we have the community, like, and so these were basically, you know, our support group. So we actually have our 2 support groups for regular everybody on the first Saturday of the month. We have our TNBC support group that Latoya leads on the first Tuesday of the month. And then we partner with YSC. They have a Black support group. I think it's once a month, and then Bright Spot. So I think that there's all kinds of stuff, but I do think we're going to build a young women support group, because now we've talked to so many young women, and our advisory board is saying, you know, I don't really want to talk to the 60-year-olds. They're not dealing with what I'm dealing with, right?
Yeah.
So I think we're gonna, you know, we definitely are gonna try to put that into action so that we have something specific for Black women to talk to each other and have an outlet. So, you know, we try to cover all the things, and this, you know, this one's a big one, you know. Sex,
Yeah. Yeah.
couple, divorce. How many conversations we have about divorce, right? And guess what? We've done a show about that, Mo.
Yes, we have.
We
Yeah,
have.
I think estate planning and that sort of thing,
Estate
and
planning, yeah, all
you
that
know,
stuff, that sort of
yep, that's
finance,
important.
no, yeah. But yeah, I'm taking some notes here to share back with the team, but I think that the surgery one is definitely something we need to.
That's a big part,
A
because
big
I
one.
met a few other women who were in the same predicament as myself, and I was
Yeah.
like, wow, you know,
Yeah, yep.
that's
It
amazing.
is, because when you think about for women, you think about breast cancer. The main thing you're gonna think about is, am I gonna lose my breast? How's my breast gonna look?
Right.
How's my body gonna look? That's like another focus. Like, you know, besides the chemo and everything, eventually you have to deal with the breast. You know, that's like an aspect of it in some
Yeah.
way, shape, or form. So that's definitely big to put on the website for sure.
Yeah, Yep, so many things, but look at what we spent in the last hour just talking about. You know, for them, we're looking at Mo and I, you and me and Mo, you and I, Mo, what's different? They're looking about, this is my life, you know,
Right,
this is
right. Different from what, right?
From what? This is my
Right.
normal, right? This is my normal as a, you know, a 40-year-old, a 35-year-old, and you know.
I think just normalizing that and saying, you know what, it is,
Yeah.
sadly, it is a normal thing
It
to
is.
have cancer at almost any age.
Right, at any age.
Right? And
Yeah.
to
Any age.
know that you are not alone.
Right.
Because I think that there can be a sense of isolation when you sit in the waiting room and you look around,
Right,
when you
and
go to
everybody's
a
like right here.
group. Right.
Yeah.
And you look around at the conversation that they're having and the stuff you need to talk about be two different
Way
things.
different.
Right?
Way different.
And so normalizing that fact that, you know what, there's community and that you're not alone, and it's not so rare anymore where people are like, oh, looking at you. Like, no, we all know somebody who felt and found their own cancer. We know somebody who was young. We know people who are, you know, who are going through some very, very adult issues at a very, very young age. Right? And that
healing.
part of it, and it's just to say, you know, I don't know. I feel like sometimes we make young people feel like they're under a microscope a little bit, or magnifying glass, because of that. And I want them to feel, I want you all to feel just like normal and accepted.
Yeah.
You know, even though what's happening to your body isn't necessarily normal. I get that, right? Nothing normal about it, but people should not look at you as an outlier.
Yeah.
Right.
Yeah.
Right.
Yeah. We have Mahalo just sent me a text. She's in the comments too. She said it's very important to have another ear. There are lots of questions that can be overwhelming. So that goes back to about bring somebody with you, you know, or and you know, we are happy to FaceTime on any doctor's appointment. Val and I do it all the time.
Yep.
You need help and you don't have anyone to go with you.
Yep.
Happily FaceTime or with you with your doctor, and I'll be texting Mo in the background. Like, like I'm on a Zoom with this patient.
Listen, that's what we're here for, right? To help each other
That's
out.
what we do, you know, like what's the deal? How do we deal with this? And so, you know, and never be able to answer every question, but I think what we tried to do here is at least create this space, this sacred space for young women to go and understand what they're up against, and watch an episode of The Doctor's In that we filmed 3 years ago. But the one thing about our business is we get new patients, we get new customers every day. How many you diagnosed today under 40? Got that on my chart. So we're here for you, and
share it. Share this video, right? If you found it interesting, enlightening, you got some information from it. Even if you don't know anybody who's going through it, share it to your page, because somebody watching, somebody on your Facebook community and your Facebook page knows somebody who's going through it. Like we all
somebody's
do.
daughter, or somebody's daughter, or somebody's granddaughter, right?
It's true.
Yeah.
It's true.
So,
So last comments. Anything else that you want to share for people who might be watching, especially young women, or for folks who might be the support system, the ecosystem who are watching? Because a lot of times that's who tunes in. They know somebody who's going through, and they're like, "Oh, show on. Let me watch and see, so I can report back to my loved one or to my home group." What advice? What do you have for them?
I want to say just piggybacking off being the CEO of your own health. You are the CEO of your own health. You are the captain of your ship. I've had so many people reach out to me because they're afraid to speak up for themselves when they're in doctors' offices. Don't be afraid. Do not be intimidated. Doctors are humans just like you are. So don't be afraid to speak up for yourself, or have someone to co-advocate for you, but do not be intimidated by credentials or whatever that may be. They're people just like you, but you are in charge of your own health, and you feel the pain, or you feel the lump, or something is not right. You have to say something. That's the only way something is going to get addressed.
Yeah, I'm putting that here. Say something. You are the CEO. Say something.
Yep.
I would just like to say, just throughout the journey, just keep a positive mindset, because a positive mindset does affect the body, and your body, spirit, and mind has to be aligned in order to get the best outcome. As what I've been witnessing since I was 15 years old. My mindset played a large role of why I'm even still here today, because I've lost many people that, like I was like, oh, we're going, and next thing you know, they're not here anymore. And me thinking I'm next, and I'm waiting, and I'm waiting, and I'm still here, glory to God. And them telling me I wouldn't be able to have a child. My daughter's 14. You know what I'm saying? So it's possible. We're here, and just take it one day at a time. That's my motto. I say that all the time, because that's all you have is today, right now, in this moment. Tomorrow's gonna worry by itself. And you got your support, but just listen to your body. If something's wrong or you don't feel right, inquire about it. Be an advocate, like Latoya said. Speak on it, because sometimes doctors would say one thing, but yourself, your body, and sometimes it doesn't align with what they're saying. So you have to fight with that, and fight for it for yourself. So just want to say that. And
that's huge.
Thank you. Wow. That's great. I put on the comments. Take care of yourself. Know your body. Be the CEO of your health. Don't be afraid of the credentials. And for me, I always say no is never the answer. It's always how. Don't let anyone tell you no. It's crazy. Fight for it. And you can fire your doctor. Not everybody's like Dr. Mo.
I did.
Yeah, you did, right?
And it's okay to get other opinions, right? Because hearing it twice, 3 times, sometimes helps reinforce that the thing the person told you the first time was actually true, and it was right. And you might not have wanted to hear it. You might not have wanted to believe it. But then you go to 2 other doctors and say the same thing. It's like, oh, okay. All right. You know what? Now I can feel more comfortable about this plan, because we'll explain it in a different way. Or sometimes you're just ready to receive it. So don't ever be afraid to get a second opinion.
Right.
For sure.
Right.
Yep. If somebody tells you no, how can we be more sure? And what should I be looking for at home? Who else can I talk to if I feel like I need to see someone else? What's our next move? What's our next step, Doc? Right? Our next step. Like it's on us. Our next step.
Yeah. Our shared decision making. Shared decision.
Yeah. What we gonna do?
Yeah,
right.
This is my body, and we're in this together. We're gonna do.
That's right.
Yeah.
Wow. We hope
and
it's
I love me.
a lot more real.
Yeah. Yeah.
My gosh. Go ahead. Say that again, Ricky.
This is for me. I love me. It's all about me loving me and making you love me.
Right.
How about it?
Right.
How about it? You know what? And yeah, and thank you for sharing in the chat. I mean, I see this is so uplifting what you're saying here. She's saying, you know what, I was blindsided and now I'm enlightened. I know that advocating for myself is important. You only get one you, right? And do what's
Right.
best for you, right? This person had 3 opinions,
Yeah.
and that is okay. If your doctor acts like it's not okay, that's not the doctor for you.
Right.
Amen.
Not the
Right.
one.
Right.
So it is okay.
Also,
Wow.
Yeah.
So listen, this isn't the end of this conversation. This is just the
no.
first
We got
part
more work
of
to
this
do.
conversation.
We got more
Right.
work to do on the website. We're going to keep
Mhm.
evolving you all of our websites. You know, we evolve them constantly. New information.
Perpetually.
We're going to
Yes.
add some more stuff to this and keep it moving and keep it, keep reaching out to you guys. Thank you, Latoya and Ebony, to help.
Yeah. Thank you for
They
having
were
me.
great helps in developing where we are today. And so
Mhm.
we'll keep
And
going
keep the
back.
faith.
Anytime.
Amen.
That's right.
Blessed love.
Thank you so much to Ricky and Dr. Mo. So much knowledge.
I appreciate you
So
so
much
much for
knowledge.
coming and sharing and being a part of this. And,
Thank
for all of you watching, please like it, please share it, forward it to your networks,
Yeah.
and tell somebody, because people need this information and it's so useful and helpful. And we have you all's handles for social media in the chats, right?
Yeah.
Yeah.
Okay.
I'll put their stuff in there. And just email me and further info and we'll get it to you. And
That's it. And
and
you can always reach me. I'm Dr. Monique Gary on Instagram, on all the social media. Ricky at Touch BBCA. Yep.
yeah, we are here for you and we'll hook you up with these lovelies and we'll keep evolving the stuff. And we thank our sponsors that helped us build this and gave us the resources and to do this work. So very
That's right.
grateful. Thanks, Black Doctor. Love you, Mo. Love you.
I love you too.
Love
I'll see you
y'all.
soon.
I'll see you soon.
Love you all.
Bye. Bless you, love.
Bye-bye.
Bye.